the top kidney pain causes and symptoms you should never ignore. I am a board certified nephrologist, which means I am a kidney disease specialist. So kidney pain is something I deal with in my practice day in and day out. There are so many types of kidney pain, whether it's flank pain or abdominal pain or pain when you urinate. And depending on the kidney pain symptom, it can really be a hint to an underlying kidney disease that you may have. So it's really important to recognize what these kidney pain symptoms mean and what's going on, because if you ignore these symptoms, it could potentially lead to you having a chronic kidney disease or even kidney failure. So whether your pain symptoms mean you have a urinary tract infection or kidney stones or even kidney cancer or an underlying genetic disease, it's very important to understand the causes of kidney pain. Kidney stones or nephrolithiasis can definitely cause kidney pain, okay? I'm telling you right now, kidney stones will make my grown male patients cry and fall to their knees. It's no joke. Now, when you get kidney pain from kidney stones, it can present as flank pain, which is a pain in your lower back, usually under the ribs, but above the hips. And it can be on one side or both. And it's where the love handles are. That's what I'm talking about when I say the flank. It can also cause generalized abdominal pain, meaning more in the front, like where you consider your stomach to be. You could get pain like that from kidney stones. You can also get side pain, which is, pretty self-explanatory. Pain from kidney stones can also radiate, meaning it can start off one place, like in your flank or where your kidneys are, and then it can shoot or radiate or go toward another area, like in the groin. And when it comes to kidney stones, depending on the location, you may have some pain that radiates not only to the groin, but then it can radiate to the testicle. Yes, if you have a kidney stone that's down in the ureter, which is that tube that connects the kidneys to the bladder, then it can radiate to your testicle on the same side. Ladies, it can radiate to your labia or to your lip and the genitalia. The kidney stone pain can be for different reasons. It can be because the kidney stone is actually blocking urine flow, okay? And if it does that, it causes an obstructive uropathy that can cause the kidney to swell and cause a pain for that reason. You can also get something called renal colic, which when the kidney stone moves, the way the kidneys work, we have a peristalsis, meaning we have waves of movement in our kidney system. Well, if the wave causes a tightness around that kidney stone, it can cause you to have a renal colic or a pain that can last for up to 20 minutes, like a 10 out of 10 pain. But then as the peristalsis continues and the tightening loosens up around the stone, then the pain can subside. So you can get a renal colic, or the pain can come from the kidney stone literally scraping the inside of the kidneys. So yes, kidney pain from kidney stones can cause flank pain, abdominal pain, side pain, radiating pain. Urinary tract infections, or UTIs, are another cause of kidney pain. So urinary tract infections are very common. It's a very common infection, usually by a bacteria, but you can also get fungal urinary tract infections as well. Women get UTIs more often than men do. It's actually a 4-to-1 ratio. Women are 4 times as likely to get UTIs, and this is why. The way that the bacteria will climb up and get into that urinary tract system or get into the urethra and the bladder, well, they have to climb through a tube. And so the way the kidney system works, you have your bladder, and then the tube that connects your bladder to the outside world is called the urethra. Well, with women, the urethra is very short, whereas with men, the urethra has to go from the bladder all the way through their organ, and so it tends to be longer. Because women have a short urethra, it's not very hard for these bacteria to climb their little sticky mean selves up and get into the bladder and cause an infection, a bladder infection or cystitis. So this is the deal with the UTI. So let's talk about some of the pain symptoms associated with UTI. You can get the abdominal pain that we talked about. Oftentimes it's going to be in the lower abdomen if you have a bladder infection or cystitis. You can also get dysuria. And dysuria means that it's painful when you urinate. Dysuria can be a pain symptom associated with UTIs. Another thing you can get is hematuria, or blood in the urine. Yes, a UTI can cause blood in the urine, and it can look bright red, or more often than not, it may look pink or like little spots of blood in the urine. So yes, this can be a symptom associated with a UTI. With UTIs, there's something that is called honeymoon cystitis. So what does that mean? Honeymoon cystitis, or inflammation of the bladder. One way to prevent UTIs, for ladies in particular, is after you have sexual intercourse and when all of that bacteria is just kind of there waiting to crawl up your short little urethra. Well, as soon as you finish having intercourse, it's best if you hop up and you urinate. Yes, you urinate. That way, any of those little bacteria, those little E. coli, those little Klebsiella, any of those bacteria that are trying to climb up your urethra, if you urinate right away, they won't have as great of a chance as getting up there and causing you a UTI. So yeah, they call it honeymoon cystitis, because if you're sitting there just enjoying yourself in the afterglow after having intercourse, well, while you're, having your honeymoon, the bacteria can be causing a UTI. Okay, just a little advice. Now, we talked about the bacteria climbing up the urethra and causing a urinary tract infection. Well, if that infection ascends, if they keep climbing up through the ureters, those tubes that can lead up to the kidney, well, then you can get an infection in your kidneys, and you can get kidney infection or pyelonephritis, which is another cause of kidney pain, okay? And the symptoms that you typically get with pyelonephritis, you are going to get that back pain, okay, which quite literally is in your back. It can even be in your upper back, or the flank pain, as we talked about, the pain where your love handles are in your back. You can get side pain, you can get abdominal pain. With pyelonephritis, you can even get sepsis or an overwhelming infection in your body that could even lead to septic shock. And certainly, again, with the pyelonephritis, you can still have the dysuria, you can have the hematuria, you can have the cloudy urine. And another thing with these urinary tract infections, you can get urinary frequency. What does that mean? You have to get up and use the restroom a lot of times. You feel like you are frequently having to run and use the restroom. That's urinary frequency. The other thing you can get is a urinary urgency. It's when you feel like you have to go to the restroom, gotta go right now. But once you get there, you really didn't have to go. So if you're having any of these symptoms, please beware. It could be a sign that you have a urinary tract infection that may have even progressed to a kidney infection or pyelonephritis. Oh, and if you do get that sepsis or that overwhelming infection with UTIs, bladder infection, pyelonephritis, you can definitely get fever and chills as symptoms. PKD, or polycystic kidney disease, another disease that can cause kidney pain. And this is a genetic disease. In fact, PKD is the most common hereditary kidney disease. In our kidneys, we have nephrons, which are the functional units that help us to filter out blood, get rid of excess toxins, get rid of excess fluid, and to help us to maintain our balance. In each kidney, and you're born with 2 kidneys, most people are, in each kidney we have approximately 1 million nephrons. Well, in these nephrons, in addition to having tiny little blood vessels, and we have the Bowman's capsule, well, we have these ducts, okay, and these tubules. In polycystic kidney disease, you have these cysts, multiple cysts that will form within these tubules. Now, the cysts themselves are benign, okay? They're literally just like fluid-filled bags. But when you get so many cysts, and especially when they start to grow and become numerous, they can actually affect the way that the kidney functions. So these cysts can be anywhere from microscopic in size to multiple centimeters and very large. And the more cysts that you have, well, it can actually start to interfere with the function of your nephrons. And if it does that, it can cause a decline in kidney function. The other thing that these cysts can do is they can cause pain. Okay, you have these multiple cysts and they can make your kidneys very, very large. And if the kidneys get large, they have to expand, right? They have to go somewhere, and they can actually be poking on your other organs, poking on your back, and they can cause certain blockages and obstructions in some cases. And so having polycystic kidney disease can definitely cause pain. In addition to causing kidney pain, PKD can lead to other symptoms as well. So yes, the kidney pain from the cyst being so large, it can also, in some cases, lead to urinary tract infections, or the cysts can become infected, which then can lead to urinary frequency, urinary urgency, hematuria, or the blood in the urine, cloudy, foul-smelling urine, all of those things. If you're having some of these symptoms that could possibly be associated with polycystic kidney disease, be sure to consult with your physician, because fortunately, we actually do now have medicines that can help to slow down the progression of CKD and slow down the progression to end-stage renal disease or needing dialysis or a transplant.